Hello and welcome back to Homeonexus. In the Keynote Materia Medica series, today we are going to decode one of the most striking remedies in Materia Medica, Ipecacuanha. Have you ever seen a patient who is having perfectly clean tongue but cannot stop vomiting? You are looking at a diagnostic paradox. So today we are going to walk through the clinical triad of this remedy from its relentless nausea to its bright red hemorrhages, and by the end of this video you'll know exactly when to reach for Ipecac in your clinical practice. So let's dive in. To understand Ipecac, you must understand its genius. It sits at the intersection of three systems: the gastrointestinal system, the respiratory system, and circulatory system. In the GI tract, we see constant nausea. In the circulatory system, we see active bright red hemorrhage. And in the respiratory system, we see spasmodic asthma. When these three meet, Ipecac is almost certainly your remedy. Now for our first diagnostic paradox, usually severe gastric upset and vomiting comes with heavily coated tongue. So whenever a patient is having unstoppable, uncontrolled urge of vomiting and having some gastric trouble or problem, what we usually find is the tongue is heavily coated. But with Ipecac, despite violent vomiting, the tongue remains clean. This is your sharpest tool for differentiation. It stands in total contrast to remedies like Antimonium crudum or Pulsatilla, which always show a thick coating on the tongue. Now looking at the physical generals, the red thread, which is having keynote, hemorrhage and hypersensitivity. So hemorrhage is occurring through the various orifices we have in our body. The sensation is there in bones as if the bones are being torn to pieces or broken, and the patient is having oversensitivity to both cold and heat. In the stomach, the nausea is relentless. It is constant, continual sensation accompanied by profuse saliva. So here is the key. Vomiting offers no relief. Even after vomiting for multiple bouts, the patient is not having any relief. The patient might vomit large quantities of white, glary mucus and then fall into deep sleep, but the nausea remains. So, nausea is persistent, is continuing even after sleep. The sensation here are very specific. So this remedy is having very specific sensation and directions. So the patient feel a relaxation as if the stomach is hanging down. The stomach is hanging down like feeling. But more often they feel a constriction, a clutching or squeezing type of pain as if the hand is pressing fingers into the intestine. Watch the trajectory. The cutting pain shoot across the abdomen, specifically from left to right. So the pain moves from left to right. So this remedy is having very characteristic stool and dysentery. The stool in Ipecac is very distinctive. It is having often grassy green or look like frothy fermented molasses. So this is our go-to remedy for autumnal dysentery. So these cases triggered by those first cold nights that follows hot summer days. It's also indicated in the early stages of Asiatic cholera, when nausea is the dominant symptom. In the respiratory system, moving to the chest, the theme is spasm. The keynote is spasm. The cough is dry, asthmatic, and extremely constricted. The slightest exercise triggers a struggle for breath. Interestingly, there is a deep psychological connection here. The patient feels anxiety about the stomach, which also contributes to the symptoms and the respiratory attacks. So in children's, we have suffocation and mucus. So Ipecac is primarily a remedy for whooping cough in children. You will see the child losing their breath, turn pale or even blue, and become stiff. There is rattling of mucus in the bronchi. Yet the cough remains dry, a dangerous sounding paradox. Often, the violence of the cough is so great that they bleed from the nose or mouth. So, the hemorrhagic sign is having bleeding from nose or mouth. Looking at the female reproductive system, the keynote is uterine hemorrhages. So in uterine pathology, the same red thread applies. Hemorrhage is profuse, clotted, and bright red. The pain radiates in stitches from the navel to the uterus. So here is the clinical tip. If the patient has heavy, oppressed breathing during the hemorrhage, Ipecac is confirmed. So Ipecac also follows a rhythm. We see intermittent symptoms appearing every other day at same hour. It is also famously used after the abuse or suppression of quinine. So looking at the modalities, the symptoms are worse in winter, worse from the slightest movement, and worse in warm, moist south winds. So finally, looking at some clinical relationships with other remedies. So looking at the friends of Ipecac, cuprum is the main complement. If a patient is exhausted after Ipecac, arsenicum follows well to address the debility. If the lungs are if lungs are failing to expel that rattling mucus, that constricted mucus, we can consider antimonium tart. But remember, Ipecac is one with the clean tongue. So if the patient is having coated tongue, we should not think of Ipecac as the remedy. Now looking at the differential diagnosis, we can see uh, antimonium tart is differentiated from Ipecac. They both have the rattling chest, but the Ipecac has the clean tongue and persistent nausea. And antimonium tart indicates when lungs fail to expel the mucus. So in both cases, we have difficulty in expelling the mucus, but the mucus in Ipecac is constricted and it is along with a clean tongue and persistent nausea. Differentiating Ipecac with arsenicum, we can see the similarity that the both of these remedies are having anxiety and asthma, but arsenicum is preferred follow-up for the debility that ensues after Ipecac, because Ipecac is having continuous nausea that creates weakness and also inertia in the patient. So arsenicum follows well in helping patient with debility. We can have differential with Pulsatilla, where all these are the ant crude or Pulsatilla are also used for the gastric problems, but the distinction here is again the clean tongue in Ipecac and others having coated tongue. So to wrap up, keep your eyes open for that clean tongue. Even in the worst gastric distress, remember that Ipecac pain shoots from left side to right side, and its hemorrhage are always active and bright red from the orifice of our body. And there is the constriction of the mucus and spasmodic asthma and congestion and respiratory problems. So Ipecac truly is the persistent, nauseant, and hemorrhagic spasmodic. If you find this Materia Medica profile helpful, please hit the like button and subscribe to join our community of learners. If you have a specific case where Ipecac saved the day, drop a comment below. We would love to hear your clinical experiences. Until next time, keep learning and keep serving. I am Devotee Doc. See you in the next video.